Hey everyone, welcome back to our channel. This is Dr. Alfred Egedovo from GHC Hospital Health Promotion. Today we're diving into a topic that affects millions of people worldwide, asthma. But not just any asthma. Today we're exploring the different types of asthma. Asthma is a chronic respiratory condition that affects millions of people worldwide. While all types of asthma share common symptoms such as wheezing, shortness of breath, chest tightness, and coughing, there are different subtypes of asthma that have unique triggers, characteristics, and treatment options. Understanding the distinctions between these types can help individuals manage their asthma more effectively and improve their quality of life. Did you know that asthma isn't just one condition? It actually comes in various forms, each with its unique triggers and symptoms. So let's break it down. First up, we have allergic asthma. This type is triggered by allergens like pollen, dust mites, or pet dander. But here's a question for you. Have you ever wondered why some people develop allergies while others don't? 1. Allergic asthma. Allergic asthma, also known as atopic asthma, is the most common subtype of asthma. It is triggered by exposure to allergens such as pollen, dust mites, animal dander, and mold. When a person with allergic asthma comes into contact with these allergens, their immune system reacts by releasing chemicals that cause inflammation in the airways. This inflammation leads to the characteristic symptoms of asthma. And speaking of allergies, let's talk about non-allergic asthma. This one can be triggered by stress, cold air, or even exercise. Isn't it fascinating how our bodies react differently to various stimuli? But here's a controversial thought. Is it possible that our modern lifestyle is making us more susceptible to non-allergic asthma? Symptoms: wheezing, coughing, chest tightness, shortness of breath, and difficulty breathing. Triggers: pollen, dust mites, animal dander, mold, and certain foods. Treatment: allergy testing to identify specific triggers, allergen avoidance, medications such as inhaled corticosteroids and bronchodilators, and immunotherapy, allergy shots in severe cases. Example: Sarah has allergic asthma and experiences worsening symptoms in the spring when pollen levels are high. By avoiding outdoor activities during peak pollen times and taking her prescribed medications regularly, she is able to manage her asthma effectively. Next, we have exercise-induced bronchoconstriction. This is a hot topic among athletes. Some argue that it's just an excuse for poor performance, while others say it's a legitimate condition. What do you think? Should athletes be more aware of their breathing techniques? 2. Exercise-induced asthma. Exercise-induced asthma, also known as exercise-induced bronchoconstriction, is triggered by physical activity. During exercise, the airways narrow and become inflamed, leading to asthma symptoms. It is important to note that exercise-induced asthma is not limited to individuals with a history of asthma and can affect anyone, regardless of their asthma status. Symptoms: coughing, wheezing, chest tightness, shortness of breath, and decreased exercise tolerance. Triggers: vigorous physical activity, especially in cold, dry air. Treatment: pre-exercise warm-up using a bronchodilator inhaler before exercise and avoiding triggers such as exercising in cold weather. Example: John developed exercise-induced asthma after starting a new running routine. By using his rescue inhaler before his runs and wearing a scarf over his mouth during cold weather, he is able to continue jogging without experiencing asthma symptoms. Now let's not forget about occupational asthma. This type is caused by exposure to certain substances in the workplace. It raises an interesting question. Should companies be doing more to protect their employees from asthma triggers? What are your thoughts on workplace safety? 3. Occupational asthma. Occupational asthma is caused by exposure to irritants or allergens in the workplace. It can develop in individuals who previously did not have asthma or worsen pre-existing asthma. Common triggers for occupational asthma include chemicals, fumes, dust, and animal proteins. Symptoms: coughing, wheezing, chest tightness, shortness of breath, and nasal congestion. Triggers: workplace irritants such as chemicals, dust, fumes, and allergens. Treatment: identifying and eliminating exposure to triggers in the workplace using personal protective equipment, medications such as inhalers and corticosteroids, and changing job roles if necessary. Example: Maria developed occupational asthma after working in a bakery that used flour as an ingredient. By wearing a mask and discussing her condition with her employer, she was able to switch to a different department and reduce her exposure to flour dust, leading to improved asthma control. 4. Non-allergic asthma. Non-allergic asthma is a subtype of asthma that is not triggered by allergens. Instead, it is often linked to other factors such as respiratory infections, stress, air pollution, smoke, strong odors, and cold air. Non-allergic asthma can be more challenging to diagnose and treat as the triggers may be less predictable than those in allergic asthma. Symptoms: wheezing, coughing, chest tightness, shortness of breath, and difficulty breathing. Triggers: respiratory infections, stress, air pollution, smoke, strong odors, and cold air. Treatment: identifying and avoiding triggers, medications such as inhaled corticosteroids and bronchodilators, and stress management techniques. Example: James has non-allergic asthma, which is aggravated by air pollution in his urban neighborhood. By using an air purifier in his home, avoiding outdoor activities on high pollution days, and practicing relaxation techniques to manage stress, he has been able to reduce asthma flare-ups. Lastly, we have nocturnal asthma, which occurs at night and can disrupt sleep. Imagine waking up gasping for air. It's a scary thought. How many of you have experienced this, and what do you do to manage it? In conclusion, asthma is a complex respiratory condition with different subtypes that have unique triggers, characteristics, and treatment options. By understanding the nuances of each type of asthma, individuals can work with their healthcare providers to develop personalized asthma management plans that address their specific needs. It is important to regularly monitor asthma symptoms, adhere to prescribed medications, and make lifestyle modifications to effectively control asthma and improve quality of life. So, there you have it. Different types of asthma, each with its own quirks and challenges. If you found this video helpful, don't forget to like, subscribe, and share your thoughts in the comments below. Let's keep the conversation going. Until next time, breathe easy.